Hi, we are the Renegades, and our project is reducing the high and inconsistent cost of care for uninsured and cash paying patients. Our team members are Dorcas, Workflow Lead, Rosen, Prototype Lead, and Beulah, Presentation Lead. Every day, uninsured and underinsured Americans face challenges in accessing affordable healthcare. This is Maria's story. She is a 42-year-old uninsured patient with abdominal pain. Maria visits two different urgent care centers and receives two completely different price estimates for the same visit. One center quotes $250, the other quotes over $900. She ends up delaying treatment because she's afraid of the cost. Our team identified a major challenge in healthcare delivery: the high and inconsistent cost of care for uninsured and cash-paying patients. Patients without insurance are often charged the full list price for services. In many cases, this amount is much higher than what insurance companies pay for the same services. This causes patients to face major financial strain, which can lead them to avoid or delay care and cause their health problems to become worse over time. And really, it just leads patients to lose trust in the healthcare system. Our target population includes uninsured patients, underinsured patients, and individuals paying out of pocket. We feel that patients should not be punished financially simply because they don't have health insurance. Why does this matter? The CDC estimates over 27 million people in the US are uninsured, and millions more are underinsured. Patients who do have insurance often face large deductibles, co-pays, and surprise bills. According to the Kaiser Family Foundation, about 41% of adults in the US have some form of medical debt. This means nearly half of American adults are struggling with healthcare costs in some way. With over 36 million living in poverty, climbing out of this debt can feel impossible. This often leaves patients to choose between paying for healthcare and paying for food, rent, gas, or utilities. It creates stress, delays care, and often leads to worse outcomes. Current solutions fall short. Today, uninsured patients are often told to call a billing office, apply for financial assistance, or ask for a price estimate. While these options exist, they are often confusing, inconsistent, and can really be difficult to access. Patients often do not know that these programs exist, or they find navigating them difficult. Costs vary widely between hospitals and providers. Many systems use medical language that is difficult to understand. Patients often do not receive a final cost estimate until after treatment. The current process really puts the burden on the patient, leaving them trying to understand bills, discounts, and confusing price systems instead of focusing on getting care. Our solution is the Fair Care Pricing Navigator. Our prototype is a low-fidelity pricing transparency and discount system for uninsured and cash pay patients. Instead of charging patients the full listed amount, the tool adjusts the price to more closely reflect what insurance companies would normally pay. In many cases, this could reduce patient costs by around 50%. Our prototype helps make pricing more understandable, predictable, and fair for patients who are paying out of pocket. So how Fair Care works: a patient arrives and is identified as uninsured or self-pay. The provider determines which procedure, visit, or test that the patient needs. Staff would use the tool to compare the list price with the average insurance reimbursement rate. The tool generates that reduced cash pay amount using that rate. Patient is able to see that estimated cost before treatment so they can make an informed decision. And then the patient receives care at a more affordable and transparent price. We believe that this process is simple, fast, and easy for staff to use. And most importantly, it gives patients clear information before they receive care. So, just like mini demo of how this would work. Our prototype includes 3 main parts: a pricing comparison chart, as seen here on the screen, which shows the standard listed price, followed by the average insurance reimbursement rate and the adjusted cash pay amount. A patient workflow storyboard, which follows the patient journey from check-in through payment and care delivery, and a mock interface that demonstrates how staff would enter a service and receive the discounted patient cost. Now, this isn't a fully developed software yet, but it is a proof of concept, and it shows how hospitals and clinics could create more fair and transparent pricing for uninsured patients. So, what would it take to make fair care a reality? Our estimated needs are a software development team, integration with hospital billing systems, staff training, IT support and maintenance, and then marketing and educational materials for distribution. We anticipate the following implementation costs: roughly $25,000 to $50,000 for the initial software design and development, $5,000 to $10,000 for staff training and onboarding, and then ongoing software maintenance costs are really going to vary depending on the system size. Who could pay for this solution? Obviously, hospitals, health systems, and clinics would be an obvious choice. Nonprofit healthcare organizations that are already helping patients with some of these costs. And then there's also an opportunity for local grants or innovative funding programs. Now, although we do have these upfront costs, the long-term benefits include better patient satisfaction, fewer delayed treatments, stronger trust between patients and healthcare systems, and increased recovery rates for the services provided. And what do we think success looks like? By making healthcare prices fairer and more transparent, we feel like our solution could reduce financial stress for patients and improve access to care for vulnerable populations. Our system also benefits healthcare organizations because patients are more likely to pay when costs are clear and affordable, reducing unpaid bills and debt collection expenses. And for patients, when they understand what they will owe ahead of time, they're more likely to move forward with treatment and less likely to avoid care because of fear of the bill, avoiding those high emergency care costs later on. The 3 main things we want the audience to take away about what we feel Fair Care offers is transparent pricing, fair discounts, and better access to care for patients. With Fair Care Pricing Navigator, patients like Maria no longer delay care because of fear and uncertainty. They know what to expect and can focus on getting better. As a team, we have all personally experienced what it's like to worry about access and the ability to afford healthcare. Our team has the ability and determination to work together to find and solve problems. We are able to work together in a way that complements each other and plays to our individual strengths. We have a true passion for helping these vulnerable populations and believe that healthcare should not be confusing, unpredictable, or unaffordable. Our Fair Care Pricing Navigator gives uninsured patients the transparency that they deserve. Thank you.